Did you know that certain maternity care nurses can undermine your confidence, sabotage your natural birth, and also cause more unnecessary interventions to happen that you weren't expecting? Hi, my name is Carly Bonderud, and this is the Empowered Birth Series where I go deep into everything that you need to know to plan and get your empowered, true natural birth. And if you've been following along with this series, then you know that we are going into the 20 natural birth traps that you want to avoid. These are the things that basically sabotage your natural birth, because there's a difference between natural birth in the medical system and the true natural birth that your body is already going to do anyway. Go check out some of my other videos where I talk about the difference between natural birth and true natural birth. But what you really need to understand is that we have this culture in our society where there's a lot of labor and delivery nurses that don't quite understand physiological birth. Maybe you've seen them in the mom groups. Oftentimes they are in there and they tend to jump over into the conversations when moms are asking, can I decline the IV? Can I decline fetal monitoring? Can I decline the vaginal exams? There are also a lot of influencers on the Instagram and TikTok and even YouTube. And, you have to understand something is that there are two types of labor and delivery nurses. There's the ones that understand physiological birth, love physiological birth, and are going to support physiological birth. And then there's the ones that either are afraid of it, don't trust it, or take a very heavy-handed medical approach. And in this video, I'm going to teach you how to get out of the natural birth trap of unsupportive care providers, which is number 10 on our list of the natural birth traps that you want to avoid. What are natural birth traps? Well, as I mentioned, these are the things that basically undermine your confidence, lead to unnecessary interventions, and sabotage your natural birth. You don't even necessarily know that this is a trap until you fall into it and then look back and say, yeah, that's what happened. That's when my confidence was shaken. So how this works is that this is a deep dive masterclass. If you do not have time right now to sit down and actually watch this whole video, then I'm going to invite you to just pause this, save it for later. But before you go download the transcript that's in the description of this video, because I have created a transcript that's basically a PDF that allows you to basically see the highlights of what's in this video, the overview, and also I've embedded links. Now, the other thing is that oftentimes I create these transcripts first and I put them out, and then I go back later and I add more links to it. So more articles, more resources, more books that you might want to check out. And again, lots of different videos that I reference, maybe even in the future, so that you can plan and get your empowered birth. That's because this is the do-it-yourself path. I have 3 paths to getting the empowered birth method, and this is the do-it-yourself path, which basically means that you can take any of the information that I put out, piece it together, put together your own map, do your own research, and that will still lead you to getting an empowered birth. No paywall, no email opt-in, nothing that basically says this is as much information as you can get, because information is free and I only charge for access to me and to a lesser extent my team. So you need to understand is that with labor and delivery nurses, they have a certain lens. And if they're not aware of that lens, then this is how you can get trapped, because we have been trained and programmed to believe that other people are the experts on our birth and on our bodies and not us. And there are many, many big holes in that logic, because when you are approaching things from a place of fear and also deferring to the experts, that is basically when you get led astray, and then you're like, I don't understand. I was planning a natural birth. How did everything turn out wrong? Well, you fell into a natural birth trap. And as I said, I'm going into the 20 natural birth traps, and this is number 10 on the list. If you want to know the whole list, check the description of this video and go get the PDF transcript, because I've just linked that list into the transcript itself. So the other thing you need to understand about these master classes is that they have a sort of structure to them. So you're going to notice it is quite long and it's also structured. Just like if you were paying for this in a typical prenatal class, I want you to take notes. I want you to treat this as if it is valuable, precious gold, because it is. The deeper you go, the more you're going to uncover. I also want to let you know about the rule of 3. If you're doing the do-it-yourself path, you do not have any external guidance. You don't have the direct email support of self-study. You don't have the laser coaching of Self-Study VIP, and you are not a client who is coming and learning from me either in my deep dive coaching programs and Mistress Minds or one-to-one, because I don't work with just anyone who comes to me. And it is very exclusive to be able to get into those communities. So what you're going to want to do is first watch the video through once at least. Then the second time you go through it, you're going to get some aha moments. You can maybe jump to the pieces where you were like, wait, I kind of got lost here before. Now I'm going to come back. You can also check out the transcript, and that will give you an idea of where you want to go. And then the third time you go through, you've got it. So you can read this, you can watch this, you can do a combination of that. We all have different learning styles. I myself am more of a visual learner. I can watch a video, but I'm not going to retain all of the information through a video recording as I would if I also happen to take notes during that, and as long as I also have something that I can read. This is different in a live class because I'm able to get that information downloaded to me directly from my mentors. But if you are somebody who can listen to a video or you're used to podcasts, hey, if you want to just listen to this as you're driving in the car, I have no problems with that. You don't have to watch me directly on the screen. You can just listen to this. I've made this easy for you because I am committed to you having an empowered birth. Whether you work with me directly or not, you deserve it. It is your birthright. It is your rite of passage into motherhood. And I don't want you getting trapped. I don't want you getting tricked. I don't want your confidence undermined. I don't want you pushed into unnecessary interventions. And I don't want your natural birth to be sabotaged. Because you know what? We have a dichotomy right now between natural birth and the natural birth community that says birth is always going to work out and you just need to prepare your body and make sure that you basically treat the medical system as the enemy, and you have to basically fight, beg, or compromise to be able to have the birth you want. And then the other side of it is birth is dangerous, it goes wrong, you need to have somebody medically manage it, and if you don't, catastrophe happens. And these two sides don't often talk to each other. Now, I am also going to say that there are nurses out there that also follow the physiological birth model. There are OBs out there that follow the physiological birth model. And if you understand that these two dichotomies exist and that there are people on both sides, fish can't always see the water that they are swimming in. So I've talked about this in other videos, and you might want to check out the Reset Your Mindset for Empowered Birth Challenge if you haven't already done so, and read my book, Your Empowered Birth, which also I basically have outlined why people aren't seeing this. You know, doulas get this wrong too. Medical professionals get this wrong. And even midwives can kind of not always see it. Because there's a big difference between going into the system as somebody who's working within the system and being indoctrinated within the teachings of the system versus actually being a mom trying to navigate that system and having a certain viewpoint of birth. If you want to have a physiological birth, a true natural birth, then you have to be aware of this dichotomy. You need to be aware that the nurse that is assigned to you, you can switch nurses, but what if you can't? And that is what this masterclass is basically going to address. What if you can't actually switch to a different nurse? Because you know what? Sometimes you can't. Sometimes that is the only nurse available. And sometimes that goes against what you were taught. But there is a way around that. The Empowered Birth Method is all about getting the birth you want without having to fight, beg, or compromise. Now, even if you're planning a home birth, I'm just going to also tell you that you need to know this information, because what if you end up changing your mind or something happens where your intuition tells you that you need to go into the hospital? I'm not saying that you have to. I'm saying that this is important. And also, this is important for the future. When you happen to take your child in to see a doctor or a nurse, or when you yourself are going in and advocating for yourself, these skills do overlap and tie into other areas of your life. You know, I used to be absolutely terrified to push back against the medical system. I used to think, because of how I'd been socially conditioned, that if the nurse says something, I have to do it. But there was things that happened in my childhood where I started to see that I had a lot more power than I initially had thought. When I had overpowered a nurse in 6th grade when she was trying to give me a shot that I didn't want in that moment, and I recognized that actually I had something called informed consent, and I could decline something I didn't want. Even if my family didn't agree with me, I was able to do that. And I also recognized I had a fear of needles, and I was able to advocate for myself strongly to make sure that the nurse that would be taking my blood for whatever reason would not hurt me the way that I had been hurt in the past. So you're going to understand these tools, and the structure of this is basically I'm going to share a story with you on basically falling into these natural birth traps and unsupportive nurses, and they can either make your birth harder than it needs to be, or you can still overcome that. I'm also going to share with you how this is a trap and how to get out of that trap. So I'm going to share with you how it undermines your confidence, leads to unnecessary intervention, and also how it sabotages your true natural birth plan to have these unsupportive nurses in your space. Then I'm also going to share some context with you. I'm going to share some birth advocacy secrets, including the ones that are inside the deeper version of my birth advocacy report. So I'll share some of that with you so you can recognize what your nurse is actually dealing with and where she's not seeing it, so that you can advocate strongly for yourself within the empowered birth method. I will teach you the empowered birth method and how it ties into getting a more supportive nurse or dealing with the unsupportive nurse. And then I'm also going to share how you can go deeper with this, the resources that you're going to want to check out, and the things to take advantage of within Empowering Moms itself. And then I'm going to recap and I will tell you what's coming up next. So that is the structure, and we're just going to get started now, okay? So the story that I want to tell today is again a story of two moms. This is kind of what I do, is I tell the story, and sometimes it's just one mom and sometimes it's more than one. So in this story, we've got me and we've got Jenny, okay? So if you're familiar with the story, and again, go watch some of my other videos or read Your Empowered Birth to really understand this. Jenny wanted to have a vaginal birth after a cesarean in the hospital because that is where she felt safest. She decided to go in at the last minute, and she knew that there was likely to be a lot of pushback because she had a lot of actual things against her, like having gestational diabetes, chronic high blood pressure, and being an older mom. She also understood that the place that we happen to be living in was not really supportive of physiological birth. We live in an area where there's a lot of nurses that they have this medical mindset and they need to follow their checklists, and our health authority is all about the checklists. And I have been working on this for several years as a birth advocate, recognizing that the nurses in the system that actually understand physiological birth, their hands are tied. And I'll get back into that at a later point. But what you need to understand then on my side is I didn't want to go to the hospital. I had planned to have a home birth. I was back then very afraid of basically pushing back against nurses and doctors because of my upbringing, and I just didn't want that anxiety. And in the end, I ended up getting talked into a hospital birth anyway. This then led to me having to fight during my actual labor. which is incredibly distracting. And instead of having the completely physiological birth without any interventions, I then agreed to have the gas and air. I asked for it because I needed to escape. So at home, with my home birth, I had the same type of contractions. They were still the same intensity, but I was able to get into my labor trance on my own. In the hospital, I wasn't. And you can go and read my story, Your Empowered Birth, if you really want to know what was going on, or check out one of my other videos that I did talking about the nurses and basically saying how I wasn't supported and telling them to go away. There was a lot of that. But recognizing that if you have an unsupportive nurse in your space, that energy, if you are not strong in your foundation, can actually start to shake you. Now, I was strong in my foundation, and so was Jenny. So we were not shaken by this. But what happens is that a lot of moms, if they are not aware of what I knew and what I had taught Jenny, they crumble under the pressure. So here's 2 empowered mom stories with 2 really powerful moms, so you can really understand how to do this. And keep paying attention because I'm giving you some secrets within this. So with mine, I had basically recognized that the nurse wasn't allowed to tell me what to do. Even if she technically had authority, I don't play with authority very well. I don't do well with people telling me what to do. And I was already mad enough that I had to go to the hospital that I was not going to cooperate. So I was fighting, I was combative, and because of that, the labor itself was not as peaceful as it could have been. I was not able to advocate for myself strongly. And then when it came time to get me onto the bed, the nurse just basically pulled rank. My midwife couldn't do anything. And then that led to me being on the bed trying to push for 3 hours. In addition to that, later on, this is the part I really want to share with you, is that in my postpartum, I was trying to go home. And the nurse kept saying, well, you know, we don't have the doctor here to discharge you, and we really need to have the pediatrician sign off, not your midwife, so you need to wait. And instead of knowing to advocate for myself strongly, I sort of crumbled and was like trying to mitigate this whole nurse pushback thing. Because a few hours after my son was born, I was sleeping. I was exhausted. He was born at like 10:55 at night. So I was like tired, and I'd also been traumatized, and I was having these dreams that I was still in labor and still on my back. So I was having these nightmares. And the nurse finally, she rouses me from my sleep at, I don't know what time it was. I call it stupid o'clock because it was dark and it was not a decent hour. And she's like, you need to get up and go pee. Now, I did not want to leave this bed that didn't have a warm enough blanket as it was to go to the bathroom and sit and shiver on a toilet in the dark just so that she could check off things off her checklist. This did not sound appealing to me. But then what she said is, if you don't do it, I'm going to bring the ultrasound machine in, check to see if your bladder's full, and if it is, I'm going to give you the catheter. And I'm like, oh, hell no, you're not. I've already had enough people telling me what I'm going to have to deal with if I don't comply. So this is the first time I really stood in my power, and I said, okay, fine. Go draw me a bath, and I'll pee in the bath. So I actually made her do a little bit more work, and I honestly don't care if it derailed her plan, because at least I was able to stay in the bathtub and be nice and peaceful, and I didn't have some nurse hovering over me, waiting for me to pee. So recognizing that, I still had to fight, beg, and compromise. Jenny, on the other hand, knew my math. So when I was teaching this to Jenny, Jenny wanted to go to the hospital for her own comfort. And I'm like, well, you know, you have a lot more factors in your pregnancy than I did in mine. And I know what these nurses are like. I know what the pushback is like. But also, because I had been a birth advocate for a number of years, and I had sat in on meetings with doulas and midwives and nurses in a birth network, I basically understood, oh, they're afraid. There's a lot of things that they aren't seeing that is scaring them. And I'd also been a fly on the wall reading comments from nurses to understand that they're not all bad. Some of them are just afraid, and some of them have just drank the Kool-Aid to the point that they think that everything is a medical event and it just needs to happen that way. I'm also going to say there are nurses inside of my family, and there are certain things that they just don't see. And they get into debates with me or try to be like, well, what if this happens? What if that happens? I'm like, well, that is less likely to happen if you actually support the physiological birth process. And then they also bring in their own traumas of what happened in their births. And I can see it right away. It's like, okay, yeah, but you had a medical birth that went wrong, and that is why that happened. That does not happen with a physiological birth. So you need to understand that nurses don't see this. And this ties into Jenny's story. Jenny had basically told her doula, I don't want anybody to touch me. Don't let anybody touch me. So they get to the hospital, and Jenny is basically actively pushing. Like, her baby is in the birth canal. Her baby is on the way out. Like, it's like an hour before this baby is to be born. And the nurse is automatically going through her checklist. She's like, I need to assess your progress to see if I need to call the doctor. And the doula is like, you need to call the doctor. Like, she's pushing. And then the nurse is like, I need to take her blood for this blood test. And Jenny's like, you're not touching me. Like, that's not happening. And later, actually, and I mentioned this in another video, is that what happened is that the nurse wanted to have Jenny's blood drawn in case Jenny needed a C-section, so they'd have the blood type on file. So the nurse didn't even recognize that this was a physiological process that was happening in front of her. She saw it as an emergency. And this is what happens, is that your nurse doesn't see that this is normal. They are not in that space. They are typically in the space where they just see everything going wrong. And depending on the hospital that they practice in, the more likely they see things going wrong. And I'm also going to share another story, though, because there was another nurse that I was in connection with. She had had her babies at a birth center, and she'd also had babies at home, and she'd had an unassisted birth. But with her fourth baby, she had basically decided that she wanted to go to the hospital just to be on the safe side. She'd had some complications. Now, being that she was a nurse, and being that she had already been helping people and helping them have their natural births, she thought that going to the hospital would be very simple. She was surprised at how heavily controlled everything was and how much she was not being listened to, that she ended up being very silent and birthed her baby under the sheet while the nurses and the doctor were basically trying to set things up for equipment that wasn't even going to be needed for this birth to happen. And afterwards, her eyes had been opened. She's like, I get what you were saying. I mean, I know what you were saying before, and I didn't think that it was the same in my hospital. I didn't think that they were going to treat me like that. I'm like, I know you didn't. Now you see it. And she's like, well, now the gloves are off. And I'm like, yeah, I know the gloves are off. Like, you saw it now. You actually witnessed it. They really were not paying attention. They were doing their checklist. They didn't recognize a physiological birth happening in the moment. And they were so focused on all of the equipment that they would need that you ended up having to basically birth your baby on your own. Now, Jenny did birth her baby on her own, and she chose to do that. But when you're looking for support, and the nurses are not supportive, this can lead to problems. So how this becomes a trap, if you're not aware of what I'm going to be teaching you deeper into this video, is that you basically have your confidence undermined. You say, I'm having a contraction. And the nurse is like, yeah, but that's not a big contraction. Wait for the other ones. And then you're like, but this one is really painful. And you're now telling me that this is no big deal, that it's going to get worse. Now that puts you in fear. Here's the thing, is that They can't actually tell on the outside whether a contraction is going to be intense or not, just based on how long it is or how big it looks like on a monitor. This is a misconception, and it leads to your confidence being undermined. If you say that you don't want to have cervix checks, and the nurse says, yeah, but then we don't know what your progress is and you're probably not in labor, that again undermines your confidence that you can do this without medical intervention. If you happen to have a nurse who rolls her eyes at birth plans and you bring in your birth plan and she's like, yeah, this is a C-section, that is undermining your confidence. If you have a nurse who is like, well, if she delivers fast, she delivers in triage, that in itself is scary. And you think that you're actually going to deliver in triage, and that can cause you to tense up. If you have a nurse who says it's policy to do this, you have to do this, that undermines your confidence to say no. And they can also chip away at it by basically saying, well, you know, you're probably not coping with contractions. Are you sure you don't want the epidural? And they ask you over and over and over again. Here is a tip if you are going to have a hospital birth or even in your backup plan. Make sure that you have it written that you will use a code word to actually ask for medication, because otherwise nurses, they might think that they're helping you by offering you pain medication. They might say, well, there's no shame in getting this pain medication, but you happen to be in a very highly suggestive state, which then has you thinking, well, maybe I'm not coping well. Also, if the nurse is mostly focused on her checklist and you're not following the checklist, that again is undermining your confidence. How this leads to medical intervention is if you say you're not having the IV and your nurse says, well, what if you bleed out? You'll need the Pitocin, and we need this, and they're catastrophizing something that might possibly maybe happen, but less likely to happen with a physiological birth. That puts fear on you. And this is what I see often inside of the mom groups, especially when a mom is like, can I refuse such and such tests? Can I refuse such and such exam? Can I refuse this procedure? And the nurse is like, yeah, well, you know what? I see in your birth plan that you don't want this, but this is why we recommend it. And you don't want something bad to happen, so maybe compromise on that. No. The empowered birth method is all about getting the birth you want without having to fight, beg, or compromise. Remember, fish can't see the water they swim in. But if you happen to have an unsupportive nurse and she's pushing epidural on you, she's pushing vaginal exams on you, she's pushing Pitocin on you, she's pushing the IV on you, she's basically kind of pushing all these interventions. And yes, they may be coming from your care provider. You never know. Especially if you happen to be in a rotational practice where the OB is basically running things, or you're with a midwife. However, because of the fact that your midwife is only brought in at a certain point, they have an OB that is overseeing things. And this is what happened to Jenny in her first pregnancy. She had hired a midwife and she wanted to talk to her midwife, but she wasn't able to. Instead, the nurses were like, well, the doctor says this, and the doctor is the one on call right now, not your midwife. So you're going to deal with this doctor. And when you understand that when you go into this hospital, you're not just dealing with your care provider anymore. You're dealing with an institution where there are other care providers that are thinking differently than your care provider. And there's nurses that are used to doing things a certain way. So you are well within your rights to request a different nurse, and I do highly suggest that you do that if that is available. However, if it's not, you need to make sure that this nurse doesn't sabotage your natural birth. And the way they do that is just by putting fear on you. If you are afraid, you tense up. If you're afraid, your cervix closes up, because it can't tell the difference between a tiger chasing you and a really overly eager nurse who just wants to do that cervix check and will push every button on you to get you to do that. So the more afraid you are, the less likely you're able to be in your labor trance, which means you're not able to get into your physiological process and tune into your instincts. Instead, you're focused on trying to fight off this nurse. Now, if you have a doula and a partner who is already on board and supportive, they can mitigate that risk. And this is what Jenny did. She knew where she was going. She knew what could be waiting for her because I had told her what could be waiting for her. And she also made the conscious decision of which doula to hire. She's like, I need somebody who's a firebrand. I need somebody who's going to basically stand up for me. And I need my partner to be okay with possibly catching the baby if the nurse tries to use her checklist. Remember, we aim for a true natural birth and we create our backup plans. And part of that is recognizing the environment that you're going to be in for birth and the people that are going to be on the outside. If you are not having a home birth, you need to be aware of the hospital environment and how this can show up. There are some really amazing labor and delivery nurses who also might as well be doulas for the work that they do. And then there's also the ones that I wouldn't touch them with a 39.5-foot pole, and they need to be out of maternity care because all they're doing is perpetuating trauma and bullying their clients and making it so that moms don't want to go to the hospital because they have been so traumatized by these nurses. One I can mention without actually saying names is that I had basically been told I needed to have blood tests. And I was mentioning that I was really afraid of needles and that I needed to have it be a gentle process. And this nurse seemed to think that gentle process means I just won't tell her when I stick her with the needle and I'll just surprise her. No, that does not help. That just erodes the trust even more. Like, I already tell you that I don't want something, and I already tell you how hard it was for me to even get here to do this procedure, to have this test done, and to get this IV, and you go ahead and be like, okay, well, I'm just going to stick you anyway. No, please don't do that. Please don't do that. And if you have a nurse like that, you need to recognize, no, it's not you. It's them. And it is absolutely within your rights to complain about that because they need to know. They need to know how they affected you. And if they don't know how they affected you, they may think that this is still okay. You also have to understand context here. They're usually practicing on dolls or other people who are in the testing space who are basically guinea pigs. And when they have that mentality that what they're doing is for the best, then they kind of miss the trauma. Again, I have family members who are nurses, and they often say things to me that really tick me off because of the fact that they just don't get it. They don't get how the way that they're saying something is not trauma informed, but is actually re-traumatizing someone. And the way that they sometimes hold down little kids and they just stick them with the needles. I hate that. When I take my kids in and it's like, I've made this conscious decision for them to get this and you're going to traumatize them. No, I don't care if that's the way that you did it before. It's not okay. So you have to recognize that the medical system is very much trained in this routine way of doing things. And it's not always trauma informed. So it is up to you to communicate in a way that people get. And it's also up to you to recognize that there are some people that just don't care. And that is where I'm going to go into the birth advocacy side, the context of this. Besides the fact that fish don't see water, and go check out Reset Your Mindset for Empowered Birth if you really want to understand how the medical system got into this mess in the first place. Reclaiming Childbirth as a Rite of Passage is another excellent resource to show you how these rights of protection that are in the medical system and this lack of awareness of the medical system can lead to this trauma and these nurses saying things that they really should not be saying, including the influencers that I'm not even going to name names. I don't even give them a platform or an audience. I don't tell you who they are because you know what? It's just, there's just too much trauma in there. to really unpack. And maybe they saw something absolutely horrific, and that informs their practice going forward that they don't want that scary thing to happen again. I'm not going to debate that. Obviously, that does happen. However, when you are in a medical institution that is not following a physiological process, yes, things are going to go wrong. They're going to go absolutely terribly wrong. But if you have both sides and you can look at things from the outside perspective and really have that self-awareness of where your traumas are, then you're able to practice in a more effective way. So when I'm out there talking to nurses, I'm always looking for where are they missing it and where are they getting it? And how compassionate are they? Are they a category 5 or can we work with them? And that goes into the birth advocacy report. So basically what you need to understand, and you can get the report itself, it's both inside your Empowered Birth workshop, and if you subscribe to the community newsletter and the toolkit, go to empoweringmomsbirth.com/toolkit just to get on the toolkit itself and the newsletter. But this birth advocacy report basically tells you about the 5 categories of resistance within nurses and doctors and basically people in the medical system, what they're really dealing with. So one of the categories, and of course I don't have them all in a list in order, so I may have them mixed up, but one of them is the fear of something going wrong. Because they have been trained on pathology and they've been trained to see things go wrong, and even in their practice, they were watching things be heavily medically controlled and then things going wrong, they have this lens now that if they leave things alone, a disaster is going to happen. Like in Jenny's case, she birthed her baby on her own, and then she was sitting on the bed and she birthed the placenta within 10 minutes. But the nurse had never seen a physiological birth of a placenta before. She had probably always seen give the shot of Pitocin in the leg, and then that basically delivers the placenta, and then you push on the stomach, and then that allows the uterus to contract. And then you also make sure that the bleeding is minimal and you clamp the cord right away. And she wasn't used to seeing a physiological delivery of the placenta. So she said to Jenny, what you're doing is dangerous, which is really, when you understand that, her mentality, physiological birth is dangerous, medical birth is the norm. And this is what is ingrained in a lot of care providers. So nurses get that training, and they're taught of all the things that can go wrong, and they're taught the medical model. If they don't have the other side, this then colors their perspective of what is actually necessary. These are the nurses that then go in the mom groups and say, I'm a labor and delivery nurse, and if you don't have the IV, then we don't have an open vein, and if we don't have an open vein, then if you need a C-section, it's going to be a lot more work for us, so please just get the heparin lock. It's not that big of a deal. Stop being a big baby about it. This is about your baby, and this isn't about you. And they basically trauma dump without recognizing that they're trauma dumping. And then anybody who doesn't have that context yet as a mom, you're now having your confidence undermined. So if it's already confronting in a mom group, or when you see it online in the influencers, how much more confronting is it when you are actually in labor trying to do your labor process? And the nurse is sitting there, it's like, I don't understand why you can't just get this IV. You know, we really should just do this IV. I know you said it on your birth plan that you don't want this, but this is why we think you should have this, blah, 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 blah. This could happen, this could happen, this could happen. And you're sitting there and you just want to stay calm and not tense. And your doula may not know how to advocate for you effectively if you haven't hired the right one, or your partner might be panicking. And same thing for vaginal exams, same thing for continuous monitoring, same thing for Pitocin. If they keep saying it over and over that you need to do this because something might possibly maybe happen, catastrophe, and they usually go for the worst possible outcome, then that is going to keep you afraid. There are different ways that this can be represented. One is the category 5. Category 5s like control at all costs. They have very little empathy. They don't care. If you keep pushing back, They will keep looking for that button to press, that fear button that's going to cause you to finally crumble under the pressure and do what you're told. Category 5 nurses suck. They need to be out of the system. They got in there for the glory. They got in there because they like to have control. And you know what? We don't need them. We really don't need them in the system. If you're going to be a category 5 in a space where mom needs to be her own best expert, please change professions. Please. Because you're traumatizing people and it's not okay, and we're not putting up with it anymore. But aside from that, categories 1 through 4, something's going wrong. They have never seen a physiological birth. So the more you're able to show them that you've done the research or have it in your backup plan, or basically trust your own bodily process and be like, no, we're fine. We're good. I do respect your experience. I do know that you have some expertise here, and I know that you're probably worried about this thing, but don't worry. We've got a backup plan for that. We're just not going to focus on that yet. Okay? We're aiming for a true natural birth. If I need help, I will let you know. If I change my mind about the IV, I will let you know. If I change my mind about vaginal exams, I will let you know. If I change my mind about having an epidural, I will let you know. Okay? Right now, I'm good. I'm good. I don't need it. It's okay. We're okay. Nothing bad is going to happen. I know you saw things in the past that were bad, and I know that's probably what's coming up for you right now, and you need to control it, but you really don't. You can trust this. You can trust that if you let this happen, you're going to actually see something that you don't get to see every day. Because not everybody is doing a physiological birth. Not everybody knows how to do a physiological birth in the hospital. Many people who want the physiological birth are birthing at home. You don't get to see that. You're not at the home birth. So if you don't see it, you're not going to get to learn from it. But trust me, if you watch this unfold, you're going to become a much better nurse moving forward than if you continue to try to control this process. The next one, of course, besides something going wrong, is fear of practicing outside of the box. They've never done this before. Trust me, a labor and delivery nurse who's operating in the hospital is not used to seeing a physiological birth. So they have never, ever sat on their hands before with a client. They may be really hesitant because they're like, but I'm used to this checklist. I'm used to going in, doing my job, and getting this checklist accomplished. But you're not letting them do their checklist. So what use are they? They're starting to wonder, well, what's my role? Well, they need to have a new role of holding space. And this is something they're probably not really trained to do as much as do all of the mechanical tasks of running the IV, getting the blood pressure taken, figuring out the fetal heart tones, making sure that they are updating the doctor on the cervical progress, and basically doing all of the things and making sure you're comfortable and offering you the pain medication, because that is what they're trained to do. That's their profession. But because that is their profession, they don't see the other side. They don't see it. They don't recognize that birth can unfold without them doing anything, that they could really just hold space and watch this beautiful birth unfold and be there waiting as a presence in the room. Because sometimes when you're having a physiological birth, you don't want to go completely unassisted, in the sense that you want somebody there as backup. And you deserve to have that, even in a hospital. The labor and delivery nurses that are like, well, why would you come to the hospital if you don't want us to do things to you? That's the wrong energy. What you really need is somebody who's like, okay, I get it. You came here because you feel safer here, because if something turns a different direction, you want to be able to call in that backup. But until you need me, I'm just going to be in my space and I will leave you alone. And if you need me, you can call me in. I will go and check on the other clients that I have who happen to be needing more of my services. Because you know what? They do have other people that they are attending, right? So why don't they get to spend more time with those who really need it when you're good? You're good. If you need them, they are just a little button press away and they will come to you. So they don't need to be hovering in your space. And this is one thing I noticed is it was really annoying when I was in the tub and this nurse just kept hovering over me. Thank goodness I was taking the gas and air so that I could pretend she wasn't there. But I really didn't need anybody in that space. That nurse would have been more effective with another mom who actually needed her than she was in my space. They could have just left me alone. But because of the fact that I was taking the gas and air, which I needed to escape this environment, they also needed to basically monitor me in case I kind of passed out and my partner wasn't able to do anything. I mean, he was there, but I could have trained him up better. I mean, I didn't know all of this stuff until after I had my son and I became a birth advocate. So first I was a first-time mom. I didn't know what I know now. But recognizing they don't know how to practice outside of the box. So again, you need to show them what their new role is. You're like, thank you. I appreciate what you're offering. And this isn't something that I actually need. And if I need it, I'll call you in. But right now, I just need you to hold the space for me. Just let me do my thing. And if I need you, I'll call you. And then that kind of takes them off the hook. If you need to basically say, hey, you're off the hook here. You don't need to be in this space. You're not going to get in trouble. I'm not going to get upset that you're not here. Go do what you need to do. And then that allows that energy of the categories 1 through 4 to be like, oh, okay, yeah, I do support physiological birth and I don't have to do all of the things and I am now protected. Because the other one, category 3, is fear of basically getting in trouble. You have to understand that nurses are also dealing with the administration. They're dealing with doctors. They have other departments that they have to answer to. And my family members have even mentioned that a lot of these departments don't talk to each other, and there's always something called passing the buck. It's not my fault, it's their fault. It's not their fault, it's not that person's fault, it's this person's fault. And they try to pass on the blame. Nobody takes actual accountability for what's going on. It's always somebody else within the system. And that's because of the way that everything is disjointed. It's a problem in a lot of hospitals that we don't see as clients. And when you are also thinking that you're a patient, this is why I keep using the word client, not patient. If you see yourself as a patient, that puts you at a lower level. So you're a client. You are hiring them. You're not a patient. You're a client. So you're basically looking at this as they have that checklist. That checklist is important to the administration. They have policies. Those policies are important for the administration. They have certain ways of doing things, certain protocols to follow. That is, again, for the administration. That is so that they can show, yes, I did my job. However, if you are not doing that checklist, they are now like, oh no, the checklist, but how am I going to show that I did my job? If you show them that you will call them in when you need them, and that they don't have to do that checklist, and they're not going to get in trouble because you will call when you need them. You're not going to sue. It takes that fear and pressure off of them. Because remember, they're just afraid of losing their license or getting in trouble, getting written up for not following the protocol, getting in trouble for not having that checklist. If you recognize that, then they can kind of breathe a sigh of relief. Unless they're a category 5 who is so attached to that checklist that they will do anything to get that checklist done because it makes them look good. And remember, category 5s, we need to get them out. There's ways to deal with category 5s, and I will be telling you that too. Finally, you also have to recognize there's labor and delivery nurses that are already kind of rebels in the system, but they don't want to step on too many toes or make too many waves, because then that draws attention to them as the ringleader, particularly if other labor and delivery nurses are also following them. Because then what happens is that if the system happens to have a category 5 up at the top, which is very likely based on the psychology of a category 5, more on that in a minute, then what happens is that that nurse is going to be made an example of. So you need to basically be so strong in your power, show them that physiological birth doesn't have to be this big major emergency, and then they see that, and then they can say, nothing bad happened. Actually, it was this amazing experience. They tell the other nurses are like, oh, yeah, I've seen that before. You're right. We really need to do something about this. Then there's also the higher up levels of the doctors and the midwives who are also supporting physiological birth. They have more of a say within the medical body and the administration, and they can start to make those policy changes. But if we can't get enough moms to advocate strongly and stay in their power, then the nurses can't do that because they're not seeing enough physiological births. They have to keep pushing the interventions that they know are wrong and they don't want to do it, but they can't make too many waves. Even my midwife had admitted that she was at the limit of what she could do in that space to advocate for me and to ensure that I could have my natural birth, because she was already pushing a lot of the limits of what her scope was. There were 3 OBs outside of my door. They were all waiting to pull rank on my midwife to get me in for a C-section because it was almost time's up on how long I was allowed to push for. There was nothing wrong with me or my baby. It was just those time constraints, and there were a lot of category 5s running things in that particular hospital. So now we're going to come to the category 5, okay? So category 5s are basically the care providers that we need to get rid of. They're the ones that got into it for a position of power and control and fear, and they really, really like to teach moms who want natural births a lesson. They suck. They also want to teach their colleagues a lesson. They will step on toes. They will get people in trouble just so that they look better by comparison. So if your labor and delivery nurse is not a category 5, but there's another labor and delivery nurse on that day who is a category 5, and she sees that this labor and delivery nurse is not following the rules, that can then lead to a lot more problems. It's called horizontal violence, if you really want to know the term. So understanding what's really going on here is that there is a whole big ecosystem and power dynamic that's going on that you are not aware of when you're in labor. So how do we get out of this? Well, with the empowered birth method, again, you need to have the right mindset. If you get past your fears, then you can also get your partner past theirs. You can hire your doula to hold that space for you. And then when you go in and you're advocating for yourself with these nurses, you will better be able to recognize what fears are coming up for them. Are they categories 1 through 4, or are they category 5? If they're category 5, new nurse, please. Or you have your doula basically running interference the whole time, and your partner is running interference the whole time. Not ideal. However, as long as you are not fighting that nurse and you're just like, you know what, I'm just going to do my thing. Other people are going to fight this for me, and afterwards I'm going to file a complaint. That keeps you in your power. The other thing is you need the right education. You need to understand what the medical system is really dealing with and how these nurses basically practice. You need to also know your rights. If you really want to have a good course or guidelines on knowing your rights, I highly suggest you check out Birth Monopoly's course, Know Your Right, with Kristen Pascucci. This course is basically telling you that they're not allowed to not allow you, okay? The other thing you need to understand is the right environment. Try really hard not to go to a hospital that has a lot of category 5 nurses. This is again why I suggested to Jenny, don't go back to that hospital. That one is like, eee. But she went to a different one and she had a nurse that was just mostly afraid. Like that's really what was going on. She was mostly afraid. And Jenny was able to just do her thing. So understanding how this ties in is if you know what the hospital environment is, if you know what the nursing staff typically are like, then you can make more informed decisions. Ask doulas. If doulas are attending hospital births, they're seeing the nurses. They know which nurses to avoid, and they know how to get a different nurse for your care. So recognizing that, we then come to the right facilitators. Your care provider is a stand for you. So you want to make sure that you have a care provider who does support your birth plan because they are less likely to give information to the nurses that's going to derail that plan. This isn't foolproof because, again, if you have a different doctor on call that day, they could be giving the instructions. So recognizing that if you happen to have a nurse who is afraid because there's a doctor that is trying to run things in the background, this can lead to their fear. So understanding what kind of facilitator do I have right now? Are they categories 1 through 4 where I can work with them? Or are they category 5 and I need to get them out of my space? And that leads to the right support. You need to have a doula and you need to have a partner. Because if you don't have your partner trained up and you don't have your doula trained up, then there's nothing standing between you and a nurse. You need to have somebody else who can see on the outside objectively while you are in your labor state. Because you cannot be in your thinking brain and have a physiological birth at the same time. That is not how it works. So understanding that, now we're going to go deeper. So the first book I would recommend that you pick up is Natural Hospital Birth by Cynthia Gabriel. This one does go into how to advocate for yourself with different nurses and how to plan for a hospital birth specifically. And the other one I suggest is Reclaiming Childbirth as a Rite of Passage, because not only do you learn about physiological birth versus medical birth, but you also understand the overall psychology of how a lot of nurses get afraid. There's some quotes in there. There's examples of nurses who basically understood the physiological birth model, but for whatever reason, their hands were tied, and it goes back into the rich history of how we got into this mess in the first place. And finally, the best resource I can suggest for you is that birth advocacy report. So there's 3 ways that you can get it. One is that you just reach out to me, hello@empoweringmomsbirth.com, and either myself or one of my team members will just give that to you through email. The other way, if you want to subscribe to the Empowered Birth newsletter, you go and get the Empowered Birth Toolkit, and the Birth Advocacy Report never leaves that toolkit. It's a rotating Google Drive of resources is what this toolkit basically is. So you subscribe to the newsletter every week and you get this toolkit to access, like a little tiny resource library where I put things in and I take things out. But the Birth Advocacy Report will always be in there. And finally, if you want to go the self-study route in Empowering Moms, and you want to basically get the overview of the Empowered Birth method, how to apply it, how to get past your fear, how to understand physiological birth, getting out of the induction traps, advocating for yourself within the medical system, writing your birth plan, and training up your partner, then you're going to want to get our self-study program, your Empowered Birth Workshop. You just put in your name and email, and as part of that, in the email sequence, you get access again to that birth advocacy report. And this will again tell you how to deal with the different care providers. If you have any questions, you can always reach out to me and my team, and we will direct you to more resources. Because I am committed to you having an empowered birth, whether you work with me or not. And I don't work with everyone who comes to me. I don't even do laser coaching with everyone who comes to me. So in order to show me that you could even qualify for one of my sessions, you need to do that work. And that is why I have 3 paths to empowered birth. You are already on the do-it-yourself path, so just keep taking notes. If you would like any additional resources, they are inside of the links of the transcript, and you can just show me that you've done a workbook or you have basically just taken notes and you're showing me, this is my plan, this is how I'm doing the work, and I may just decide, you know what, you've done enough that I can trust that if I ask you certain questions to target what you're dealing with, especially with your fear around basically dealing with a nurse that may not be supportive, I can turn that around within 15 minutes. I don't take calls longer than 15 minutes if you're not in my high-level coaching program. So this is why you need to show me that you're at a certain level, understanding the empowered birth method, so we don't waste that call on something that I could have just given you a resource for. So there is an intake form for that. Because again, with the premium coaching, I want to make sure that this is not something that you just basically wasted money on that you didn't need to. I'd much rather you put that investment into yourself and into a birth location that feels right for you. Maybe you need to travel to a further away hospital and you need to have accommodations, either a hotel or an Airbnb. You need travel expenses, so that you're not in a hospital with a bunch of Category 5 nurses who are going to hold you down and ruin your birth because you keep saying no, but they are more focused on getting compliance than they are on recognizing you are a human being and you deserve to be treated with dignity and respect. And it is never, ever okay for anyone to hold you down and force you to stay somewhere you don't want to be. It is never okay for you to have to say, I don't want a vaginal exam, and for them to hold you down and force it on you. It is never, ever okay to force you to have an IV. It's not okay to hold your baby in because you're pushing before the doctor gets there. That can lead to nerve damage, and it actually did for a mom in the States, where she had basically thought by changing hospitals, she was going to get the birth that she wanted. But it was just a very clever PR campaign that turns out that's not how the hospital practiced, and nurses actually held her baby in. She had severe nerve damage. She ended up having to sue the hospital for damages because her pelvic floor was basically ruined. She has continuous pain. So I've actually linked that within the transcript if you want to read more about that case. But this is why I say we need to be alert to what's going on and where this fear is coming from so that you can protect yourself. Because I'm not going to say don't go to the hospital if you actually feel safe birthing in the hospital. Not everybody has to have a home birth. If that does not feel safe to you, you deserve to have a safe alternative location. You deserve to be able to birth in the hospital without them forcing things onto you. And so with the empowered birth movement, what I really want to do is if you're going to put any money towards coaching, or if you're going to put money towards getting self-study VIP, or to get any of my books or anything else that I put out, then I want to make sure that that money is being directed towards things that are actually going to help. And so all I ask is that if you're doing the do-it-yourself path, please like, share, subscribe, pass this on to other moms, pay this forward, because I don't want to splash ads all over the place. I want to keep my ad budget very, very small and focus most of the proceeds towards opening up birth houses and allowing moms to have more access to doula support, having the ability to be able to travel to other hospitals if they need to, and ultimately changing the face of birth so that we can have that beautiful empowered birth wherever we choose to give birth, and every birth can and should be a beautiful and empowering experience. No more excuses. So again, with the do-it-yourself path, you're basically taking pieces of the map and you're putting it together yourself, go through these deep dive master classes, take notes. Also take advantage of the rule of 3. Watch once, get the overview. Watch twice, get the aha moments. Watch 3 times, integrate it, implement it, and then tell me how it works out for you. If you have any questions, email the team, hello@empoweringmomsbirth.com if you are not already subscribed to the community newsletter. If you are a subscriber, just hit reply to any one of our emails and then somebody will get back to you within 1 to 2 business days. And laser coaching is also available for you when you reach a certain level. Now, to get to that level faster, we have self-study. This is when I have my courses that basically take all of the pieces and put them together in a more concrete way to give you more of the map. You can still take your own magic and add your own pieces and all the information within the do-it-yourself path, but now you also have the framework. And this is accomplished, first of all, through my book and the Reset Your Mindset for Empowered Birth Mini Challenge. So first, go through the Reset Your Mindset for Empowered Birth Mini Challenge because you cannot get new information if you are still dealing with all those underlying fears. Second step is you want to read Your Empowered Birth. Now, I've made this easy for you. You can go and get the book off of Amazon, or you can go into the playlist of my YouTube channel and you can listen to the book. Absolutely, just listen to it. Then you have the same overview and you don't have to try to sift through. But the book itself is actually very thin, as you can see. It's also very simple to read. The chapters are easy to follow. I don't put a lot of dense material in there. In fact, I actually created extras for you to go deeper with this because I didn't want that book to be overly dense. I wanted it to just be that map for you. And then once you've gone through Your Empowered Birth and done the initial work through there, you then go through Your Empowered Birth Workshop, which again, you just put your name and email in and you get emailed that course, okay? You get instant access to Your Empowered Birth Workshop. Now, it doesn't come with any direct email support and it doesn't come with any additional direct support through coaching. This is called Self-Study VIP. So if at any point as you're going through Your Empowered Birth Workshop in the free path, you're like, you know what, I kind of want to have somebody walk me through this, you can upgrade to Self-Study VIP and it's less than the cost of groceries. So what I do is basically you are able to send in your homework as you complete it. And we look at your workbooks and we look at what's going on and we either give you additional resources or we create something for you. And then once you finish the program, you have that option of getting your laser coaching call either with me or one of my coaching queens. And this is not a sales call. This is basically we look over your stuff and then whatever it is that you need to work through to get your empowered birth, we're going to help you with that, okay? So again, information is free. I only charge for access to me and also to my coaching queens because path number 3, premium coaching, is not accessible to everyone. We don't have a lot of time slots available to fill for the high-level coaching clients. We keep our programs very small and intimate. Our Mistress Minds are about 3 to 5 people when we run them. And we are looking for that deep level transformation for moms. So it's not just about birth. It's not just about advocacy. It's not just about true natural birth education. It's really about a whole life approach to having that empowered birth and having a more connected relationship with your partner and advocating for yourself strongly so that moving forward, you're able to do that for yourself and for your child and for your partner and have the most extraordinary life possible. Empowering moms isn't just about birth. When you have an empowered birth, you're an empowered mom for life and no one can take your power from you again. Okay, so that was a lot, right? I know, but the thing about unsupportive nurses is that when you understand just how much they derail your natural birth plan, you really do need that psychology and understanding what's really going on. So let's quickly recap here. Unsupportive labor and delivery nurses that roll their eyes at natural birth plans or have a very medical model, they are undermining your confidence and telling you basically you can't do it without them. They are pushing interventions that is then going to lead to more intervention that you don't want. And they're also sabotaging you because you can't be afraid and also have a physiological birth. You can't tense up. You need to be able to stay calm. You need to be able to stay in your labor trance. And certain labor and delivery nurses are very good at distracting you from your labor trance and making it harder for you to actually have that deep and connected experience. They can traumatize the hell out of you. You don't deserve that. I also talked about the different categories of resistance and fear. Make sure you go through and check the transcript again, rewatch this video, and definitely check out that birth advocacy report because that is important. And finally, I told you about the empowered birth method and how you basically want to have the right mindset, the right education, the right environment, the right facilitators, and the right support. And when you have all 5 of those and they're optimized, then you get your empowered birth. And finally, I also told you about 2 different resources that you want. You want to get Natural Hospital Birth by Cynthia Gabriel, and you want to get Reclaiming Childbirth as a Rite of Passage by Rachel Reed, which, I mean, if you've been following me for a while, you probably already have that book in your collection because I've talked about it so many times. It's one of my favorites. Okay. So now that I've recapped and you understand about the labor and delivery nurse and you are now on your way to planning your empowered birth, I just want to thank you so much again for watching because remember, if you are planning to get your natural birth, you need to have all of the facts and I am determined to give them to you. So if you have any questions, all you have to do is reach out hello@empoweringmomsbirth.com and either myself or one of my team members we'll get back to you within 3 to 5 business days. It's 1 to 2 business days if you are on the Empowered Birth newsletter. And if you happen to be a coaching client in one of our Mistress Minds, or you happen to be in the higher levels, then you already have access to us on WhatsApp. So you can use that as well. Okay, so thank you again for watching. If you found value in this, please like, share, subscribe to this channel. Pay it forward, pass it on, because a drop in the ocean creates ripples, many ripples create waves, and enough waves can change the tide. And here at Empowering Moms, we're all about changing the tide so that you can have the life of your dreams, because you deserve it, Empowered Mom. You deserve to have the most beautiful birth experience, and I believe that it is possible because my clients have done it. I've shown this method to many moms, and you are your own best expert. So take your power back. And next week, I'm going to go deeper in this with the unsupportive doctors and midwives. So stay tuned because we're not done in addressing the categories 1 through 5. And I will also be telling you more birth advocacy secrets and using the empowered birth method to get out of this natural birth trap. So thank you again for watching. Have a happy empowered birth journey. Whether you're birthing a baby, birthing a business, birthing a creative project, or birthing a new version of yourself, Empowering Moms is here for you on your empowered birth journey. Thank you again. I'll see you soon. Namaste.